Dr. Coto is a board-certified interventional cardiologist with additional extensive training and expertise in all phases of non-invasive cardiology, preventive cardiac care, risk factor identification and modification, and research participation. He also holds a nuclear license for sophisticated nuclear stress testing, performance, and interpretation. I told you we have the experts here today. Dr. Coto has nearly 30 years of cardiology experience caring for patients throughout the greater Tampa Bay area, and he's fluent in both English and Spanish. He's the man. Thank you, Dr. Coto.
Good morning. I think it's very refreshing to know that after 36 years in private practice and a combination of academic practice and other, I have now, for the first time in my life, the opportunity to work with a board-certified heart failure specialist, because they are very few. We have only, I believe, only two in this area, so I'm honored to work with Dr. Schmittner, who actually gave an excellent presentation. I have been in practice for many years in Tampa, for about 28 years or so, and I don't plan to quit soon. In addition to being an interventional cardiologist, which means that I deal with the pipes mostly. I also, for multiple reasons, became a reserve deputy, so I'm a sworn officer. That doesn't mean that I'm going to arrest anybody or that I have my legal gun with me today. So I thought that I would be talking of the heart in general and basically go over for the next few minutes with a very basic understanding to what might lead to heart trouble. And I'll tell you, the heart is a relatively small structure, about the size of our fist, if you have any idea, but it's very complex, as it was mentioned before. My main job that I have to do is in regards to the vessels that feed the heart muscle, the coronary arteries. And after years, these clean vessels, because of multiple factors that we're going to be talking about, it might lead to what we see here, which is plaque formation, build-up, and heart attacks. It is really worrisome to know that in the US alone, about 17 million people die because of cardiovascular disease-related conditions. And what is really more important is that at least 13.6 million people might be saved, because some of those are preventable. Some of those deaths are really preventable. So that means that we have more work to do. If we go back and see what's happening today, let's go back to the 1940s, right after we came back from the World War II, and remember that most kids in our schools exercised, they went out, they were slim, they were thin, there was almost no obesity. But when our soldiers returned, of course, they wanted to have more. The wives were already working in factories. So when they got together back again, then the industrial revolution here exploded, and everybody wanted to have everything. More food, more entertainment, and things like that. Now this slide is very important because it shows how plaque atherosclerosis progresses from the very early years, from the first 10 years, all the way to about 40 or 50, at which time most of us will have some plaque already formed. Okay? So it is very important to realize this. At this time, if the plaque breaks, that's what leads to acute and chronic events. Now, this was demonstrated with soldiers who died during the Korean War back in the very early 50s. Those soldiers were actually studied by autopsy, and the pathologists doing the studies were surprised. They found that most of those soldiers, 18-year-olds and up, had already plaque formation, the famous plaque that leads to heart attack. In addition to this, in the 1950s, something else took place in the US, which is inception of fast foods. So the combination of a new life plus the introduction to fast food such as McDonald's, this kind of restaurants actually changed our way of living. Amazingly, the founder of McDonald's was a type 2 diabetic. Can you believe it? Jeez. And this is what we were introduced to. Kids eating French fries, hamburgers, fast food, and from there on, other hamburgers actually were introduced, really good, really tasty. From there on, other companies introduced more and more fast foods. So this actually changed our way of living, our way of eating. There was no more long cooking at home. And then we saw the kids from the 1940s to the 1950s, 1960s, until the 2000s. This is what is happening. This is what is happening to us because of our good life that we have. And if we look at this slide, we can see the obesity trends in the US also have gone up since 1970 all the way up to our days, in such a way that almost 40% of our population have to deal with this medical situation called obesity. In addition, kids also went up. Their weights went up. But this is really complex. It's not only food. It's also introduction of television. Now media, now computers, everything. Kids don't go out. And I don't blame kids for not going out because there's a lot of things outside on the streets, but television was also one of the causes of obesity increase. So until we came to this, now in high schools and colleges, we have a major problem, which actually has led to this epidemic to extend to other countries. How many of you think of Chinese people being obese? Very difficult, but remember McDonald's actually went to China, and other companies went to China, and what happened? Chinese have cars, have TVs, and all of that stuff. Boom, problems like this all over the world. The real problem is this: we do not exercise. We think we exercise when we take our dog for a walk, but no, we don't really exercise. We drink Coca-Cola, we sit watching TV, and we don't monitor our weight. So that's a major problem. Another problem is because of the stressful life that we lead, where you want to admit it or not, blood pressure has been going up, creeping up. In addition to that, we actually had forgotten how to eat healthy. And that's a problem. So what exactly has happened? What exactly has happened? I don't really know. I think the answer is very complex, and you have to take into consideration multiple factors that I've already spoken. But the problem is also stress. No child is born smiling. Every child is born stressed out already, crying. In addition to that, we take the child, we take blood from there, we spank them sometimes for them to revive. So that's a bad way to come to the world. In addition, males are submitted to circumcision. That's very bad. We don't ask the kids for their permission to do this. So life is stressful. Can they say anything? No, they cannot. The only thing that kids can do is, in the beginning, is cry. That's how they show. That's how they communicate. So it is very difficult. So we live the first few years of our life very stressed out as well. And the stress continues after, changing from mother breastfeeding to a bottle. They don't like that, of course. So stress continues, and they continue to cry, and more stress throughout our early years. So, but if you're lucky, 20 or 30 years later, that stress is going to be dealt with However, we live in a very stressful society. After 9/11, year 2001, stress going up. So everybody's stressed out. I go to a restaurant around here, it's a Cuban restaurant, and the owner has 2 TVs going on, Fox News and CNN. And I know what his political affiliation is, but he's watching both. And people are watching the news constantly. That's stress. Don't watch the news, listen to classical music, do something else. Stop watching the news. Maybe once a day you watch the news. Now is one president, in 4 years there will be somebody else, 4 years before somebody else. We have fractions. We have to forget about being so about being so stressed out. So stress is very important for heart condition. And then we go to school. Well, when I went to high school and went to medical school, I had books, textbooks. I didn't have computers, but yes, we live stressful. So we have a curve actually. And if we try to keep our stress around here, not overloaded or burned out with stress, like is happening to physicians and other people, it will be good. So remember, dealing with stress is very important. Also to prevent heart disease, that's the whole thing. Can stress kill you? Can stress kill you? Absolutely. I deal with patients who suffer what we call a broken heart syndrome. Believe it or not, a broken heart syndrome is a clinical condition. I usually see 1 or 2 of these a month. Usually it's caused by intense, actually it's manifested by intense chest pain. Mostly in women, I've seen maybe 1 or 2 men with broken heart syndrome, and usually caused by an emotionally stressful event. I remember a lady, her mother died, and the next day she came to the hospital with this kind of situation, and it's a heart attack. Actually, this situation can lead to a heart attack, and it has to be treated as a heart attack without stents, by the way, because it can lead to heart failure if we don't really pay attention. So, yeah, stress can kill, and it's caused by grief and stress. So it's a known situation, remember that. So there are multiple ways to manage stress. I'm not going to get into this because I have my own ways to manage my stress, and you should recognize stress and try to do something positive to also manage your stress. You know, slow down, keep calm, be positive. One of the things that I did was, because I think I'm a type A personality, so I put all of that effort of being a type A into becoming a type B. Didn't work, okay? So have fun and take it. Right, so relax, refresh, recharge, redo whatever art you want to use, but there are some ways. So remember that I was talking about how plaque continues to form, and all of us might have some plaque. Well, this picture actually, the first time that I knew of something called angina pectoris, because actually there was a painting, it was drawn by a famous doctor, Dr. Netter, who back in the 50s described the typical chest pain, sometimes the first, like this, you know, stressful situation, angina pectoris that might lead to heart attack, and might actually block the vessels that we are talking about. So in addition to what I said, we have to deal with a lot of other things. Drinking, it was already mentioned, but drinking is excessive, I think, in our society. I think it's good to have a drink or two, that's up to you, but if you can handle alcohol, please don't drink. I myself don't drink at all, but there are some other things around. I remember in the 1980s when crack cocaine was introduced to our society, a lot of people were dying from heart attacks from crack cocaine. So it's not only drinking, smoking, but now we have to deal with pills. We have to deal with people still using cocaine. When anybody comes to the emergency room with chest pain, whether young or old, we get a cocaine level. It's a must. You don't have a choice. We'll just do it because there are some medications that cannot be given if there's cocaine in your level. And we need to know. We need to know if the patient has. A lot of people don't admit that they have been using cocaine for multiple reasons. We respect them, absolutely. I don't judge, I respect, but we just get it. And of course, nowadays, we have to confront a society in which we have legalized medical marijuana. We have an opioid crisis. We have multiple things. So if you think that people driving there are driving without anything on their system, you're wrong. I know, because as a deputy, I have seen many times people driving impaired, not from alcohol exclusively, but from some other substances. So the real problem for us is this, what we call metabolic syndrome. This kind of belly, like this, is very dangerous, because if you get people from India or from China, when they come to this country, there, the majority of older people are skinny. When they come to the US, they're introduced to our foods, they begin to develop a belly. And that actually leads to multiple things, to high blood pressure, to diabetes, to hypertension, to other things. Metabolic syndrome was already well described. This is for Euroids, for people from European descent. If men have a circumference waist of more than 40 inches, if they have a high blood pressure, which by the way, the blood pressure standards or the readings have already changed, so it's more than 130 over 80, 85, triglycerides elevation, cholesterol abnormalities, and of course an abnormal blood sugar. So that's what we call metabolic syndrome. So that's why when we see people with excess adipose tissue around the waist, we have to be concerned about this and appropriately counsel them. So that can lead to heart attacks, cardiac arrest, stroke, and other conditions. So that's the plaque forming there, and if that plaque ruptures, let me go back one. If this plaque, even if it is not totally obstructed, if it ruptures because of stress, either a stressful situation or mental stress, a little blood drop can actually end up obstructing the vessel and having a heart attack. That's why doctors tell you, take your aspirin, an aspirin a day to keep the doctor away. That's not totally true, but remember that it doesn't take long to have that. Blood pressure control, make sure that your blood pressure, today there's no reason why anybody can go to Publix or any place to have your blood pressure checked. And if you have any abnormalities, do it. I check my blood pressure when I go to Publix. In addition to that, diabetes, elevated blood sugar. Diabetes is very, very prevalent in the Western world, in the civilized, in the advanced countries. It is very important to also control diabetes. Obviously, 135 is very high, so that's a must. And of course, statins. Statins were developed back in the 1980s. I remember 1982 when the first statin was actually introduced. I think statins have to be added to the drinking water because they are so important. And I myself have been on statin for 15 years just to keep my cholesterol below 100. But I think statins very, very important. Statins have a bad reputation, or had a bad reputation, that they cause a lot of side effects. That's not true. That's not true. I don't see side effects from statins that often. The benefit of statins in what I deal with and heart failure and others are way above the possible side effects. So remember statins. And of course exercise. Somebody asked earlier this morning, if weights, of course, weights are very important, but if you have any conditions that prevent you from lifting weights or something, there are all kinds of exercises, but exercise activity is very, 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 very important to try to prevent, having a stent. This is what I do. I deploy stents, but the stents that I put are basically the ones that I deploy. It's just a little band-aid in the whole spectrum, you know. I think it's more important. This is one of the multiple stents. This is the small size of stent, but they prevent, they help, and they're very expensive, by the way. The next thing that I haven't really talked about is tobacco abuse. Tobacco abuse. Thank goodness, for the first time, it was reported that the use of tobacco in teenagers has actually slowed down in the US. First time ever. But back in the 1940s, you had doctors smoking. The American Medical Association said it's okay to smoke. And I remember doctors smoking while doing procedures and all that. That's gone. We now realize that smoking is very, very bad. So try to stay away. If you smoke, do your best to try to quit smoking. That's because that leads to open heart surgery, to a lot of things. And what does this represent to me? All of that, job security. Because as long as people are going to be doing this, I'm gonna be busy, believe me. So if we talk about the risk factors, what leads to heart disease, we can talk about three major risk factors, three groups. One is mechanical, the other one is chemical, and the final is behavioral. Let's talk about the mechanical. We have hypertension and obesity, mechanical risk factors. Hypertension, take your blood pressure, don't wait. Even when you're young, you have to take your blood pressure. And if you have a problem with obesity, I do realize that obesity is very, very, very difficult to deal with. One of my relatives went through gastric sleeve surgery. She has lost more than 100 pounds. She's healthier than ever. It is difficult to deal, but do your best. Do your best. There are multiple ways to try obesity, hypertension, multiple drugs, multiple things to do. The second group of chemical risk factors include diabetes and cholesterol. We already talked about that. And the final is behavioral. Behavioral is the way we eat, the way we don't exercise, and the way we use medications. So if we think of this every day of our lives, you might be able to prevent or to delay the inception of heart disease. And of course, genetic, there's nothing we can do over this. So remember, the heart gives us quantity of life. The brain gives us quality of life. And it's up to you to manipulate your brain to try to have good quality of life. And of course, we have to promote health one way or another. So one of the characters, well, I have been reading the newspaper since I was 6, and the favorite part of the newspaper is the comics. This character is one that I really admire. Dagwood. Why? Look at him. He's been married to the same lady for more than 75 years. He is a type C personality. Relaxed. You never see him yelling, screaming. He is always next to his wife, helping her sometimes. He is always lazy, doesn't exercise. He eats whatever he wants to. Has not gained an ounce of weight in the last 75 years. So I really admire this guy. I wish I was like that. And of course, married to a beautiful wife. This is another one that he's always laughing. He's always eating healthy. Carrots, right? Again, doesn't gain any weight, and he's always running back and forth, doesn't use any cars, anything like that. So keep that in mind. Those characters represent what we should do in life, you know, be like that. So if you have any questions, I'll be happy to get into that. Yes, sir.
You know any proven ways?
Hold on.
You know any proven ways to reverse plaque in your arteries?
Do I know any proven ways to reverse plaque? If the plaque depends upon how the plaque, if the plaque has been there for many, many years, you can reverse some of it. In fact, there was a guy, a cardiologist, his name is, he's still alive, Dean Ornish. Dean Ornish is a cardiologist who has been advocated vegan diets or vegan eating habits. Vegan is no animal products, no meat of any kind, no milk of any kind, only products, total vegetables. And he proved at one point that might reverse some of plaque, plus probably statins and exercise. However, since it is very difficult to be vegan, I was a vegan for 10 years, and it was very, very, very difficult to do it. I think it's very important to, instead of trying to reverse and preventing, number one, and if we have plaque, to try to slow down or to stop the progress of plaque. The easiest is probably a combination of factors that I mentioned, statins, exercise, eating healthy, and so forth. Any more questions? Okay, doctor? That's
A role of chelation therapy for atherosclerosis.
That's a very good question. Some physicians do prescribe chelation therapy. As far as I know, there's 1 or 2 studies that have been done, have never been proven to be totally effective. Chelation therapy is injecting some substances in your veins, calcium combinations and others to try to neutralize the plaque. As far as I know, no. I don't really know if chelation therapy is one of the conditions that is paid by insurance companies, but as far as I know, no. Any other questions? How many of you had breakfast this morning? Do I have time? Okay. How many of you had a healthy breakfast? Very good, very good. And today there's a big game. Of course, we're going to celebrate, and we're going to be making an exception today, probably eating some food that we might not be eating otherwise, and enjoy life, being like that would. But just remember, keep this in mind, that to be healthy, you have to invest time, energy, and effort, day after day after day, every day, and exercise and do healthy things. Any more questions?
All right, everyone give a round of applause to Dr. Coto, please.
Thank you.
All right, so it is about right on schedule. We got about 10 more minutes, 10-minute break. We'll come back at around 10:35. We'll have Dr. Amargani, our spine surgeon. Thank you, everyone.